infectious disease specialists affiliated with Palm Beach County hospitals break down what the standard protocol is to treat COVID-19 if you're admitted to the hospital.
We only have one medication that actually fights the virus, and that's remdesivir.
But before you get to that point, you might ask, why do some people get admitted and others with symptoms do not?
It's hard to predict how they're going to do, but each person begins their own COVID journey.
Doctors say most patients who have oxygen levels at 95% or above are not admitted.
They go home, so maybe they'll get a Z-Pack. If they're mildly hypoxic, maybe they'll get the steroids.
Monoclonal antibody therapy is the only outpatient treatment for COVID-19. It's given through an IV or shots under the skin. It's a lab-made protein designed to produce antibodies and block the virus from attaching to cells. But doctors say it's only effective early on.
If it's given early enough, it seems to decrease hospitalization by 70 to 80%.
Infectious disease specialists Dr. Larry Bush, Dr. Leslie Diaz, Dr. Olayemi Osiemi, and Dr. David Dodson all agree you're likely to get steroids and remdesivir to treat COVID-19. If the illness progresses, you'll also get an anti-inflammatory medication like baricitinib. But as Dr. Osiemi explains, there may be some scenarios where you aren't given these drugs.
Such as remdesivir. If you have bad kidney failure, you can't give that drug. If you have kidney failure or liver problem, we can't give remdesivir.
And then there are the drugs most doctors are not even prescribing anymore, ivermectin and hydroxychloroquine.
Because these are drugs that are called repurposed. In other words, they had a specific purpose like rheumatoid disease or parasitic diseases. And now the government looked at the information and said, we think it may be beneficial.
Ivermectin is used to treat parasites and hydroxychloroquine is used to treat autoimmune conditions and malaria.
Why aren't they being used as, a protocol of care in the hospital?
Hydroxychloroquine has been extensively studied since last year and no clinical benefit. Ivermectin, the way this started was that it showed in the test tube some antiviral activity. The problem is that the amount to get an antiviral activity is far and above, in a human, is way above toxic levels.
But Dr. Bush, Dr. Dodson, and Dr. Osiemi also say convalescent plasma is another form of treatment that is not widely used anymore.
The data, from what we know so far, from our experience from all the research that's been done, the plasma can be effective in some scenario, but not always.
Dr. Diaz said it's still another tool in her COVID-19 fighting toolbox.
Sometimes it's just hope for the patient. And unless you're doing them harm, which you're really not, in some of these very benign medications, I think it's just another tool that you can use.
The doctors all said vaccinations are still the best way to prevent hospitalization from COVID-19 and offer hope that in the near future there may be more options to treat the virus at home.
So the next evolution in COVID infection is if we could come up with some antiviral pill that people could take relatively on before they got to the hospital, that would be kind of a game changer in all this.
Michelle Casada, WPTV News Channel 5.